So in about 2012, I started doing breast reconstruction above the muscle instead of below the muscle. And I had a number of patients who, all things said, just felt better when it was above. And I thought, why am I putting it under the muscle at all anymore? Just, is this the right thing to do? And patients just responded so kind of glowingly when you just you put the breast where the breast should be. There's so many things I've learned from my patients. Sometimes like a 6-year-old tells you the truth, right? Sometimes someone will tell you, so will say, can't you just do this? And you'd say, initially maybe the medical field would say, oh, I'm sorry, no, we can't do that, of course. And then 5 years later, they say, oh, that patient was right all along 5 years ago. She said, can you just take my love handles and put it in my breast? At the time we said, no, that's not possible. And then finally we catch up to them. So, I had a patient who was like, shouldn't we put the implant where the breast is? Yes, right. That was simple truths, right? Like yes, you're correct. We probably should put the implant where the breast is. If you're trying to make it into a breast, then you should put it where the breast is, and that's not under the muscle. So
we were putting it under the muscle. Why? So it would stay still and not fall down?
I mean, if I'm being technical about it, I could say, well, there are a number of challenges that we were, but the truth is, right? I mean, I could come up with our societal talking points of why the submuscular plane was the correct one for that implant. But what I'm saying, like that, but when you step back for a moment and you say, like, big picture, if I were a 6-year-old, I would say the only reason you had to do that is because there was something not right about the implant. It wasn't, you couldn't put the implant wasn't good enough breast to be able to put where the breast is. And so if it were more like a breast, if it had more characteristics like a breast, then you should put it where the breast is. And so essentially what I'm trying to say is when I made that journey in the reconstructive world of switching to, you win if you put it where the breast is supposed to be, whether it's natural tissue or an implant or whatever it is, some combination of the two, a hybrid construct, it should be where the breast is. Right. And then the reasons we didn't do that were related to the implants. And if the implants get good enough, the capsular contracture rate is fine to put it above the muscle. The rippling is fine to put it above the muscle if you have 100% fill. If the gel is soft enough and natural enough in its movement and it can sort of respond to gravity and look like a teardrop, then you can put it above the muscle. All of those are reasons the implant has gotten good enough that now we can put it where the breast should be, right? So that's kind of a revolution too, to say, do we have an implant that's good enough that we can put it where it should go? And so that's transformative. So there are two things you get out of that. The first is you don't have to mess with people's muscles, so the recovery is much easier. But a lot of people say, I work out, or I'm a CrossFitter. I don't want you to mess with my muscle. I say, great, we don't have to anymore. We can put it above the muscle. We can put it where the breast is. That's where the breast should be, and that's where the implant will be. The recovery is easier when you do it that way. So you have something that is just less onerous, less difficult for your life. And so you'd say, well, I would like to do something that doesn't, impact me negatively. And that's what the new implants promise to do. You don't have to say, oh, I'm sorry, we're going to have to put it under the muscle to compensate for the rippling and the fill volume and the gel and the capsular contracture rate and the infection rate and the soft tissue cover, all of these reasons that we sort of make up that really head back to the main point that it's not a perfect breast yet.